Assessing special at-risk populations. Many times poverty and the homeless population are terms used simultaneously, with one being used to describe the other, as they are always so closely linked to one another. Extreme poverty leads to inadequate housing and homelessness. In 2018, over half a million of 330 million individuals in the U.S. experienced homelessness on any given night, with 35% of those sleeping unsheltered. In 1987, McKillop identified 5 steps in need analysis. 1. Identify users and uses of the need analysis. 2. Describe the target population and the service environment. 3. Identify needs. 4. Assess the importance of those needs. And finally, 5. Communicate the results. A needs assessment of the homeless population would be best used by those who would act on the basis of the report, such as the community health nurses, who are charged with identifying vulnerable populations and implementing measures to improve health through direct care or improving health care access. The homeless populations are made up of people from all walks of life. This could include those who are unemployed, earn low wages, or are migrant workers. Homeless individuals are those who do not have regular nighttime residence and can include individuals who temporarily reside in a shelter, institution, or on the street. This population is usually living in poverty and are unable to pay for food, transportation, shelter, clothes, and medical care, making them at greater risk for diseases such as tuberculosis, HIV, AIDS, or malnutrition. Community health nurses can assist in providing a cost analysis, impact, and feasibility studies for possible solutions. They could advocate and provide efforts towards political activity to provide needed services for people who have mental health disorders and are homeless. The community health nurse could also help alleviate existing homelessness by making referrals for financial assistance, food supplements, and health services. Educating the public on the services available in their areas, such as welfare programs, access to food pantries or soup kitchens, and how to gain access to Medicaid and Medicare. According to McKillop, needs are value judgments that a target group has problems that can be solved. Problems are revealed by comparison of expectations with outcomes, and discrepancies are problems. The homeless have been shown to suffer increased morbidity and mortality and multiple poor social determinants of health in comparison to their housed counterparts. A lot of health discrepancies are connected to the access of health services or the lack thereof. Some of these barriers of access to health services directly relate to unemployment and low wages, in turn creating more barriers such as being unable to pay for transportation, shelter, clothes, food, and or medical care. Further, a group with maintenance needs can develop poor outcomes if services presently offered are withdrawn or altered. For example, if someone suddenly loses employment, this could lead to poor outcomes of being homeless, or if someone with a mental illness loses their insurance or ability to maintain their prescriptions, this can also lead to poor outcomes. Conducting a windshield survey is an important tool to assessing several community components by driving through the community. It provides a descriptive overview of a community, but results are based only on visualization and does not include input from community members. A survey of the people of the community would allow for observation of at-risk populations of homelessness, noting their general appearance, such as their age, dress, whether they're well nourished, obese, frail, or unkept. By observing places, the nurse could identify resources in the community, such as location of health services and the natural environment, as well as human made environment. A review of the social systems would reveal whether or not there are certain social services, clinics, hospitals, dentists, and healthcare providers available within the community. What services are provided by the local religious groups, community centers, or if there is public transportation available in the community as well. The community health nurse plays an active role in assessment, data interpretation, and problem identification. Who was Florence Nightingale? Florence Nightingale lived between 1820 and 1910 and is known as the founder of modern nursing. She was a teacher, reformer, reactionary, and revolutionary, championing the cause of healthcare reform for the good of all. Nightingale's environmental theory highlights the relationship between an individual's environment and health and depicts health as a continuum and emphasizes preventative care. She believed that the environment has a great role in providing safe care and prompt recovery. Her theory focuses on taking care of a patient's environment in order to reach health goals and cure illnesses. The environmental factors that affect health, as identified in this theory, are fresh air, pure water, sufficient food supplies, efficient drainage, cleanliness of the patient and the environment, and light, particularly sunlight. Florence Nightingale's environmental theory is a patient centered theory that focuses on the care of the patient rather than the nursing process. One could argue, why could this theory not be applied to the community health nurses or by community health nurses to at risk populations environments rather than just patients encountered in clinics and hospitals? According to this theory, the environment has the foremost impact on patients' prompt recovery. Nightingale, in Notes of Nursing, mentions that many of the issues faced by the patients are not directly associated with the disease itself, but the environment in which they are living. In many cases, homeless populations may be able to advocate for themselves. In many cases, homeless populations may not be able to advocate for themselves, whether it be from lack of knowledge or lack of access to resources. The principle of beneficence has seemed to many to constitute the very soul of morality, or at least very close to it. It says that we should actively promote the well-being of others and prevent or remove harm to them. If we consider applying these concepts to major ethical theories, we may find that utilitarianism is the view that right actions are those that result in the most beneficial balance of good over bad consequences for everyone involved. Community health nurses advocating for fresh air, pure water, sufficient food supplies, and efficient drainage in their communities would demonstrate both utilitarianism and the principle of beneficence. For Kantian ethics, the core of morality consists of following a rational and universally acceptable moral rule and doing so solely out of the sense of duty. By this theory, the nurse is justified of advocating for the same as before out of a sense of duty. People who have a mental illness make up a large segment of the homeless population. For this segment of the population, autonomy and decision-making capacity are concerned. You must respect a patient's autonomy, but at the same time be able to determine if they have the ability to make decisions for themselves. At the same time, the nurse must be careful not to override the person's actions or decision making for their own good, otherwise known as paternalism. Assessing for decision making capacity involves determining whether or not a patient or subject is psychologically or legally capable of adequate decision making. In conclusion, the differences between a head to toe assessment and an advanced health assessment may be vast, but also have points in common. Community assessment is a comprehensive approach that emphasizes the community as the patient, with the goal of providing benefit to the people of the area as a whole, rather than just individuals. In this way of thinking, it is not a stretch to be able to apply Nightingale's environmental theory to the community, as the community is the patient in this situation. The homeless population is one of the most vulnerable and susceptible populations to environmental factors. We see many discrepancies in this population that could benefit, many disparities in this population that could benefit from manipulation of the physical environment. If the nurse considers the community as the patient, then the comparison is very similar. As the clinical nurse would assess a patient in the clinic or hospital from head to toe, assessing each body system and noting abnormal findings, the community health nurse assesses the community systems from its people, places, services, and operating systems, and noting any abnormal findings that could hinder the community's overall health. In this way, Nightingale's environmental theory works very well by manipulating the community's environment to promote the health of its populations. Just as this theory works for the patient in the hospital to promote healing by manipulating a patient's local environment. Using the nursing process, nurses can determine health needs within the community and assist in developing and implementing strategies to meet those needs. For the graphic to go along with this, I've chosen to do a Mindly, which you can see we have our homeless population in the middle, and then we can look at many things that they're at risk for: mental health disorders, malnutrition, skin disorders, TB, HIV, AIDS. We can also look at the many barriers to this population. Those include the unemployed, low wages, their inability to pay for transportation, shelter, clothes, medical care, and food. Then we will look at Nightingale's environmental theory and the environmental factors that affect overall health, being fresh air, pure water, sufficient food supplies, cleanliness, efficient drainage, and light. And finally, we can look at the community health nurse and see some of the actions that they can play in this population, such as cost analysis, impact analysis, feasibility studies, patient advocacy. We could make referrals to health services, financial assistance, or food supplements. And of course, always educate the public about resources available to them, such as welfare, food pantries, and Medicaid, Medicare.